Okay, guys.
We'll continue this conversation.
I want you to continue to enjoy what you're eating, but we are going to go ahead and get started. And we've got a lot of things that we want to cover today, and we're going to be doing some hands-on practice stuff as well. But the first thing we have to cover is there's a new, well, it's not new. We need to review an important policy and procedure as it relates to patient privacy, patient draping, just respecting concerns that some patients may have about different parts of their body being exposed or worked on by other people. Now, we in our, oh, by the way, welcome to Aide training on February 20th. Okay, all right. This will be uploaded for those that aren't here to watch later. In our profession, there's a lot of physical contact, and the more you're involved in this type of work, the more comfortable you are with it, typically. Many of you may have experienced when you first came into this environment, like, you know, working on somebody's low back or on their upper glute or upper thigh or something like that was a little maybe awkward to you, or you were uncomfortable with it. But as you've been doing it more, you've recognized that it's in a professional and appropriate setting and manner. It's therapeutic, it's helpful, it's appreciated, and it's not regarded in any way weird or awkward from our perspective. But when you're the patient and you haven't had that experience, imagine them in your shoes. That's the first time that they've had somebody, you know, touching them in that way, and it can be awkward and uncomfortable. So there are some things that we need to make sure that you're doing in order to let the patient feel comfortable and know that they're safe in this environment. The first one is the doors to the rooms are never closed when you are in the room with a patient. The door ajar, the door open is critical for them to know that we're not concealing or hiding or keeping something from the view of the rest of the office. Now, when I say that, just the door open ajar is a safety feature that makes it so that you can't say or do something that wouldn't be heard or seen by others, and so it's a deterrent to something awkward or inappropriate taking place. That's the first thing. The only time the door is to be shut is if the patient is in there changing their clothes and then letting them, if you give them a gown or tell them to change into a pair of shorts, always make sure you say to them, open the door when you're ready and shut the door. So they know that exactly what's expected, but they also know that they're safe. The second thing is when you are putting an electrode on a patient and you're putting it in an area that could potentially be regarded as questionable to the patient, maybe not to you, but to them, like if it's down in the low back, or if it's a female patient and you have to undo a bra strap to put it in the upper back or something like that, make sure you say to them exactly what you're doing before you do it and make sure they're okay with it. So, for example, like if I had Alice A on the table and I was going to put electrodes on her low back, and the therapist had said to Alice A, I want those pads below the belt line and above the belt line for the patient's low back. What Alice A, as the patient, and if I'm the aide, I would say to her, now Alice A, I'm gonna just slide the waistband down a little bit so I can put these electrodes on the lower back section. Is that okay? It's really important that you say that, because that establishes to the patient your level of respect for them. And it's going to help them feel more comfortable and less likely to be tense or uncomfortable or awkward. Now, one of the main things about setting up a patient with heat and electrical stim in any position is they have to be able to relax. And if they're not comfortable, they're not likely going to relax. And if they're not going to relax, then they're not going to get the maximum benefit out of the treatment. So that's very important to establish with them. Ask them, is this okay? They say okay, then you go ahead and do that. when you're doing a massage in an area like that, low back, undoing a bra strap, up around the neck, up in the upper thigh for a hip flexor or something like that, it is important that you're using a towel to drape the clothing so you're not getting lotion or gel on them. Again, say to them, Alice, I'm going to put this towel just up inside the hem of your shorts. If you would like to put that there, we just want to make sure we're not getting lotion and gel on that and establishing the area for the treatment. Is that okay? Just make sure you say that. We often assume that because we may think, well, this patient, we're looking at the exercise sheet, it's their 4th time in, it may be the first time you've worked with them, and if you assume that they think it's okay, don't. Just ask, and I guarantee you they will appreciate it. If they say no, or if they have a question, respect that and say, fine, you know what, let's just go, I'll go ahead and let Steve or Karen know, and then we'll just kind of proceed as best as we can with how you're comfortable. And if you say it like that, that's not an accusation, it's not an indictment, it's not a judgment of any sort. You're letting them know that they're in charge, they're safe, and you're not going to do anything that makes them feel awkward or uncomfortable. So we want to make sure we cover that, the door open, making sure it's okay, letting establish that. Now, that being said, each of you are at different levels of your training and your experience in our clinic. If there's something you feel uncomfortable with, please let us know, because we don't want to put you in a position that you feel awkward or uncomfortable with either, because how effective are you going to be? It'd be like, a 16-year-old just got their driver's license and asking them to be in charge of driving the President of the United States around in his, entourage. It could be a rough left-hand turn coming up. I didn't mean that. That was a good pun though, because they all go left now. No right-hand turns in this current administration. Edit that out, okay. Or send it up the chain. So what we're going to talk about today is we are going to talk about massage. And so what I'd like you guys to do, we have 6 tables here. We have 16 of you guys, so I want you to divide into 6 groups, 2 to 3 people on a table, and then we're going to go over the different types of massage, and just have one person on the table, probably lying on your stomach, and we're going to work on their calves. So go ahead and split that up, move your plate. You can put your plates and stuff over on this table. We can probably use these five tables over here.
I don't know.
Is that okay? I did go for a run this morning.
Yeah, I'm gonna put this pillow on.
They're probably pretty tight.
Is that okay?
Now, before and after you do any massage, I want everybody to get some hand sanitizer on their hands before you touch anything, and then after you do it. I feel like I'm on a cruise ship.
I just spit in my hands a lot.
Whoa! I wanted to get your feet too. That's okay, we'll clean the floor up.
Brooklyn, are there 2 or 3 of you over there?
No.
I'm only 1. Wait,
You good?
what?
Yeah.
No, there's 3 of us.
I gotta tell you, when I was in Mexico a couple weeks ago, every single building we went in, there was somebody with this, just like squirting our hands. I was the cleanest I've ever been down there. Okay, so 1 person on the table.
Oh, you should steal one of them.
All right, who knows what the different types of massage are? Joseph.
Effleurage and petrissage.
Effleurage and petrissage. What are they? What is somebody else? Tell me effleurage. Alice, it's a French word. You got this.
It has a flower in it. I don't know.
So yes, that's actually probably why it's effleurage. I mean, how rough is a flower?
Not very.
How many people here have ever been attacked by a flower?
A couple times.
Put your hands down. Oh, that's the stem, where the little thorns are. But a flower is pretty. It's soft. It represents some type of compassion and a relationship between the giver and the receiver that is special. So effleurage is a soft, gentle type of massage. So every massage that you give, whether it's a calf, whether it's a hamstring, whether it's a low back, a neck, a shoulder, the first minute of the massage should be effleurage, which is light, smooth stroking. So go ahead and do that. This finger walking thing isn't going to happen over here, Joe. Sergeant at Arms and Legs. That's his new nickname, because he's going to work all your arms and legs to the bone. With respect, I say that. So also another thing about effleurage should incorporate your entire hand. Okay? Your entire hand should be involved in effleurage. Your fingers and your palm of both hands should be in contact with the patient the whole time. So what I'm going to do right here is, if you guys can see up here, I'm going to show you what effleurage is not. Okay, so Alice, are you having a good day? Is this calf getting better? Does it look like I'm afraid to touch it? Does it look like I'm going to get cancer from you? Do you have COVID? Because I feel like you might be giving it to me. That is very scary. That should not be effleurage. Effleurage should be this. So Alice, how's your day been going?
Good luck, my calf's killing me.
Yeah, well, we want to make sure that calf starts feeling better. You see how I'm kind of working my entire hand? I do not want a single square centimeter of that calf to not get worked, okay? And my body position from here, which is, I could be a statue or, something like one, or I can use my body weight, stagger my feet, get in a position where I'm not going to get tired working on this calf, okay? So your body position and your hand position are important for effleurage. You want that massage lotion to last for that whole minute and just kind of stroking the body part. Go ahead. You don't even need to put lotion on that. I was going to say something else about that. Oh, direction of massage. Who knows what the basic principle of massage direction is? Alexis.
Always go towards the heart.
Always go towards the heart, especially if you're working on an extremity. If it's a hand, wrist, elbow, arm, ankle, knee, hamstring, calf, hip, work towards the heart. What is the general rule if you're working on a torso? The upper back, low back, something like that. I mean, are you affecting extremity circulation when you're working on the torso? Negatory, you're not. So what you want to do is you want to be familiar enough with the pattern of the muscle tissue that you are working, Brooklyn was going to say it, that you're working with the grain of the muscle tissue, right?
Yes.
Okay, very good. So that's effleurage. Joseph, you mentioned another type of massage, petrissage. So Alice, I don't know what that word means in French. What does it mean?
I don't know what that means. It sounds like petrified from Harry Potter.
Okay, well, she was very helpful with effleurage. Petrissage is,
Never heard of that.
yeah, no, that's good. Harry Potter, we're going to figure a way to work this in. I can't think of a way. This isn't like me. I usually come up with stuff like this. Petrissage is definitely deeper. So if you're doing effleurage on a body part, let's say, again, on Alice as the example, if I've been doing effleurage through the entire calf, but the area that we've been focusing on with maybe ultrasound and electrical stim is on the medial head of the gastroc, then what I'm going to do after the effleurage is on the petrissage, I'm going to now start to slow down the pattern, and I'm going to start to apply deeper pressure. Now, I'm not going to do it like this.
Ow.
I won't do that. This is called bad massage, which is French for bad massage. Okay, you want to get just more firm pressure. Now, the things that I want you to practice today, and we're going to talk about these, are how to get the maximum amount of pressure with the least amount of effort on your part. So, if I just want to squeeze on that calf and massage that out, how many massages a day am I going to be able to give before my hands start to fall off my arms and I have to ask people to scratch my nose because my hand doesn't work anymore? 2 maybe. Yeah, you're going to get really tired. So a technique that you can use to increase your petrissage effectiveness or efficacy, an applause would be nice. Man, I'm a ham. So put the thumb of one hand on that muscle, then take the palm of the other hand, put it right over the thumb, and push the thumb into and up the leg. How does that feel?
That's good.
Does it feel like I'm getting deeper?
Wait, see that?
Now ask yourself as you're doing this. Now you go ahead and try that, you guys. As you're applying that technique, ask yourself if you feel like you're working harder or if you're not working as hard.
They feel pretty
Ask
similar.
yourself. Okay?
That's sore, you know?
Well, let's see. If I just
You might be more sore than you think.
Yeah, are you finding yourself?
So get feedback from the patient. So now your patient is going to give you feedback and tell you, now try 2 different techniques. Try just the squeezing with your hand, and then the thumb under the heel of your hand, and ask your patient to give you feedback on which one they feel is deeper.
So you don't like that?
No, I hate that.
She doesn't like this.
Yeah, no, that's not fun. And you're going to get tired way fast.
Can you guys do the lateral flexion? It's really sore there.
Yeah,
Oh, yeah,
I would
right
say
there.
so.
Now,
Yeah.
what let's do is let's have you guys rotate so the person on the table is now coming up and being part of the massage team, and then pick one of the people on the massage team to go on the table, and I want you to go on your back. On your back. Wow, that was close.
That was too close.
You almost did that on film. Come on in. That's okay. I saved you guys some waffles. Those are made and haven't been touched by human hands, if you're interested. But there's others in here. So go ahead and make up something and bring it back here. We're just doing massage.
Yeah, those need that.
Okay.
My legs are heavy.
Now, this massage that you're going to do is on a quad. So you want to, where do you want to put the pillows and why? Who's got an answer? Joseph?
Yes.
Where are you going to put the, well, Seth.
Seth.
The other Seth. This patient's going to be lying on their back. You're going to be working on their quad. What are you going to do to make their body more relaxed for that massage? Pillow-wise.
I would put a pillow like maybe under their knees.
Okay, a pillow under their knees. Very good. And do you know why?
So that the muscle's not like completely extended, it's flexed a little bit so it's relaxed.
Exactly. You're going to shorten
Wait, I was
the
like, you want 2 pillows,
insertion
1
to origin of the muscle, so the muscle can relax, and then you're going to be able to get more of a circulatory response in the muscle. So certainly a pillow for their head, but one under their knees. This you can just do right over the pants, okay? Oh no. So go ahead and do effleurage first.
I'm just a really foolish person.
Now, guys, everybody listen up here. Alexis made a very, very good observation for the people that are working on her. You will come across this, if you haven't already. People's quads are super ticklish. Many are more ticklish than others. The way to minimize the effect of ticklishness on the patient is by firm and maximal contact. So, we're going to do a little experiment with Alexis here. I'm going to switch into this. So Alexis is lying here. I know that we're working on an athlete with a quad strain, and she's ticklish. Now, if I do this, she's gonna jump off the table because this is super, super ticklish, and I've got all of maybe 7 square centimeters of surface contact with these fingertips. Now, you know what that just felt like? Now what I'm gonna do is this, and I want you to tell me what the difference is.
It's much more full.
Okay, I have everything in contact with her. Now that doesn't mean that both hands are moving. It doesn't have to be. But if you want to make sure that patient is not going to be ticklish, then make sure you maximize the contact. So I've got one hand that's in one place and not going anywhere, and the other hand is just starting the effleurage. Then after 20 or 30 seconds, I can switch that and do the other hand. She's not getting tickled. This is therapeutic and not just crazy tickle fest. Okay? So go ahead and do that, guys, for a minute.
Nice wording.
Tickle
You're
fest.
gonna have an uneven leg.
What's up?
Now, one thing that we want to make sure we brought this up. How many of you guys go in a room, work on a patient, and don't say a word? We've all done that. I mean, you'd all be liars if you didn't say you've done it once or twice, because sometimes that happens. But it's really, really important that you actually communicate with the patient. And what do we want to ask the patient during the massage? At least a couple of times. Yeah? How's the pressure? If it can go deeper, if it hurts. Yeah. Okay, well, we'll remember that.
I don't think I've ever had my quads work on.
I'm gonna have you guys, I'm gonna have one of you go over there with Trey and Joseph, and the other one with Spencer and me. Okay. All right, we're gonna rotate. This time, I want you to put whoever has not been massaged on the table on their stomach, and we're working neck and upper back.
Oh man, I should have gone on the table for this one. Dang, I chose the wrong one. That's okay.
Upper back, and neck. Okay. Now, one thing I've pointed out to you guys many times, and it's a Jamba infraction, is pillows under the ankle. I don't recommend that you ever ask the patient if you can put pillows under their ankles. Just tell them you're going to put a pillow under their ankle, unless they don't have an ankle. Then it'd be very hard to do that. Like a bilateral amputee. Don't just assume you're going to put a below the knee amputee. Just tell them, okay, now what I'm going to do is I'm going to go ahead and lift your legs and put a pillow underneath your ankle. Because if you ask them, how many of us really like to put other people out? Like just make them do things that we don't think they should have to. Most of us don't like to do that. And a lot of our patients are so polite that they'll be like, oh, it's no big deal, you don't have to, and oh, okay. Well, you know what? I want you to put it there, because when you have those pillows underneath their ankles, their calf muscles are relaxed, their hamstrings are relaxed, which means there's less pressure on their low back. It takes pressure off the pelvis. So whether or not they ask for it, just do it. And they'll comply, they'll let you put it underneath there. If they don't like it, they'll tell you, and if that's the case, they go ahead and take it out. But just do it as a part of normalness. You're just gonna put that there. Now we're working in the upper back and neck. Again, this isn't an extremity, so massage to the heart isn't really the important thing here, but the muscle tissue and the connective tissue around the scapula is really going to determine how we do this, okay? So, right here, what I'm going to do on this patient while I'm working on their upper back and neck is I'm going to identify where their their medial and lateral border, their scapula are, and I'm going to do my effleurage like I'm working up the sides of a triangle, okay? So I'm just going to go up the back around the scapula here and up through here, and honestly, a minute of this, and this guy's gonna fall asleep.
Oh,
Okay? Because I'm not putting any pressure on him, but I am keeping both hands in contact with the patient. So go ahead and do that. Each of you just, it's almost like you're, wiping something off their shirt. You got a booger there. Let's get that off. Oh, a little Cool Whip for their waffle. Very violent eater. And again, the effleurage pressure is super light. So like if there were literally a spider under that shirt, you would not be killing it with this pressure. I know. Don't worry, we'll be killing the spider next. But not yet. We want that spider to think it's got a shot.
Sorry.
This is just my favorite shirt. Anytime there's anything on this
Good. You guys are doing good? Now, petrissage, you're going to go the same direction. And you're going to do the same thing with your hand placements, but you're just going to drive that pressure a little bit more. I want you to do that with your whole hand, and then I want you to try it with the thumb under the heel of your hand. Now, if the shirt is riding up on them, one of the things that you can do is you can take your hand, your other hand, and just hold the shirt down. And do it this way so it's not going up on you. And you can go both directions. You can work from the top down and from the bottom up on this. Now, every once in a while, you're going to find, and you guys have become very good at this. I've had many of you come to me and say, so I worked on, Mark, we're working on his shoulder, he had a really big knot, a tight knot right in the upper trap or the levator scap or something. If they have that, in the petrissage portion of the massage, you can identify that, and then put your thumb there, and put the other thumb on top, and then just do like a small little circular push on that knot.
That's not okay, man. I'm so jealous of your back.
But as soon as you do that, then finish it with a little bit of an effleurage, so you're kind of releasing some of the tension that might be developing from their reaction.
Giant knot, I swear.
Go ahead and try that.
Do you feel pressure?
Where it hurts the worst, so I can push it
Now, I really like what I'm seeing. You guys are doing a great job with your body position. Your legs are far apart enough so you can shift your body weight without getting tired doing this. That's awesome. Okay? Now what we're going to do is we're going to leave this person on the table, but you're going to take off their shoes, leave their socks on, and you're going to go to their feet.
Do you want me to just flip around?
Oh, thank
All
you.
right.
Can
Okay.
I ask if you could grip me?
On the foot. When you guys are working a calf or a foot, I really want you to get used to doing something where you're either putting that leg up on yours or just holding it up like this. If they have the motion in their knee to get there, put it there. Okay? It's a lot easier to work the foot when it's closer to you than when it's down on the table. All right? So you choose. Some of you are taller and some of you are shorter, so there'll be, you may not be able to get your knee up on the table and do that. But if you can, put their leg up on yours, and then you can really work around that foot. Now, on the foot, I want you doing a lot of squeeze where, actually, I'm going to go over there so more people can see this. Let me borrow one of Seth's feet here. So, if you guys can see this, I've got his foot up here, his ankle, the crux of his ankle or the talocrural joint is resting on my thigh. And what I'm doing is I'm taking my whole hand and I'm working on the foot, so I'm squeezing from the top of his foot with my fingers and the arch of his foot with the heel of my hand and working that right here. Now, Joe, I want you to give me a little feedback. I'm working your foot with my whole hand like this, or I'm working your foot like this.
Whole hand.
There's really not a question, is there? Okay? It doesn't take much to do that. Now, I could get away with that for 30 seconds before this hand is dead. So what am I gonna do after that? I'm gonna go ahead and take my other hand, I'm gonna push on these fingers and work into the arch of the foot here. Then I'm gonna take this hand and I'm gonna bring that into the game and work the foot this way. I am not ever gonna spend more than 20 or 30 seconds on any one technique ever. Because I don't have the energy to do that. None of us do. Or we shouldn't try to. You will last longer, you'll give the patient a much better massage, they'll feel better with it if you switch up your technique frequently, okay? So don't get stuck in one thing that feels like, oh, I could do this all day. Because you know what, honestly, they're gonna be tired of that. How long do you think somebody can handle you doing this to them when you're having a conversation? So, Joe, how long will it be before you give me the pin on your debit card while I'm doing this? It's like torture. So, switch up your techniques about every 20 to 30 seconds. Go with full hand contact and grip, squeeze, move around on that whole foot. You do have to be conscious and aware of where there may be a surgical scar or a wound or something like that. For the sake of this exercise, nobody has a wound on their foot. Okay? Maybe a get out. You ate too many waffles. What'd you do? No, maybe an ingrown toenail.
No, that was a bone. Yeah. That they chopped out.
Oh my gosh.
It's okay.
Yeah.
Okay. We're going to rotate around one more time. I want a person who has, just rotate a person into a chair. Their arm is going to be on a table, and we're working on the shoulder.
I just forgot to switch. Oh darn. Your phone and wallet. Oh yeah.
Okay, so for the purposes of this particular massage technique, I do want you to have the arm up on the table. You can put 1 or 2 pillows or no pillows underneath the elbow. If you'll get feedback from the therapist based on the stage of recovery on the shoulder. If it's a post-op shoulder and it's 1 or 2 weeks post-operatively, we may actually have the arm just resting at their side. And if that's the case, like right here, we may actually put the pillow like this and have them rest their arm that way. So depending on where they're able to be in their post-operative rehab parameters, we don't want to put them at risk of pulling out an anchor and having to redo the surgery and me having to settle some kind of a lawsuit for 80 grand because they have to, go through their surgery again. 30 grand I can handle. 80? Okay, just sell my truck.
I can handle 30.
So, on the shoulder, what we're going to do, and then go to the other person, go to the other shoulder and just pretend that that arm is up so you guys can work these techniques. So what you're going to do is, again, full hand contact, both hands. Let me just use this shoulder, we'll pretend it's up. So what you're going to do is come in from behind the patient.
Oh, there we go.
One hand is going to be on the front of the shoulder, full hand contact, the other hand behind, and effleurage is just working around the scapula and working around the upper trap, working around the deltoid, all those directions, okay? If there's post-operative tape over a surgical site, many times it's totally fine, and if you have a question, ask the
Are you my
therapist.
friend from the Taco Bell?
But does it feel like I'm doing anything dangerous to the patient?
No, not at all.
Not a lot of pressure, just kind of establishing
It's
with
all
the
right
patient
now.
what the
Yesterday
contours
and
feel
the
like.
end of Thursday, I was like,
He's getting to feel what my hands feel like on his shoulder,
I even got
and so I'm getting ready to do my petrissage.
Did you?
Now, when I do my petrissage on the shoulder, what I'm going to do is I know this, that the posterior cuff and the bicep are often culprits to shoulder pain, regardless of what we're working on. It may be a post-op rotator cuff repair, it could be a labral repair, it could be an AC separation, it could be just a shoulder that hurts from falling off a bike, okay? But getting into the posterior cuff and getting into the bicep are gonna be very important in these shoulder massages. So when I go to petrissage, I'm still gonna keep both hands in contact, but I'm now gonna start pushing from the front and the back at the same time, so I'm kind of squeezing the shoulder between my hands, okay? So tell me the difference between me working on the shoulder this way and me doing this.
Oh, that first way is the way to go.
Okay, hand on front, hand on back, working the shoulder like this, okay? Go ahead.
I had no symptoms for either shot.
Really?
Yeah, so I'm surprised.
Lucky.
Sorry.
Yeah, I was like dying. I couldn't come into work yesterday because of it.
And so you're doing great, but I'm gonna have you keep your hand more like this. And then
Oh, you're good, you're good. Don't you just scoot back? Just scoot back.
You don't really have a lot.
how does that feel? Does it feel better to keep your palm more, yeah.
Always go more.
Okay, now you've been working the back of the shoulder. Now reverse that process to where you're making sure you have pressure from the back, but work up the bicep. What you could do is you could put your hand just like this and you bring your elbow.
Oh, I see, okay. Yeah.
So now you come here like this.
Just find that tendon and get all the way down.
This. Okay? So you're gonna come into
Just got my
this.
first professional massage.
Does that feel like it's
Now, it's true that when you're working on a shoulder, your head is gonna get closer to their head, okay? Don't try to whisper sweet nothings in their ear. But, in order for you to maintain a mechanical advantage, you've gotta get in there so you're doing this with your arms and it's closer to your body than this. If you're working on them out here, you will not make it. You gotta get in there like this, okay?
tough job here?
I just said right now, I don't want to do it.
And then one more rotation we're gonna go into. Go ahead and rotate again. This time we're gonna have one person sitting on the chair and they're gonna be putting their forearms on the table and putting their forehead on their forearms. So what, yeah, we're gonna be working neck and shoulders, upper traps. Guys, when you're working on a patient who has a neck injury that we're doing ultrasound, massage, and stim, they may be lying on the table for the modalities, but ask them when you're gonna do a massage on their neck if they're comfortable with this position, sitting in a chair, leaning their forehead onto the pillows and just letting their head and neck relax that way. So when you're working, so yeah, you guys are doing fantastic. Effleurage on the neck, yes.
What if they're not comfortable?
If they're not, then leave them on the table. Yeah, we work for the patient. Always ask them if that position you're gonna work with them in is comfortable and if they're okay. So on the neck, what we're gonna do here is you're gonna come in from behind in effleurage on the neck, you're gonna be working, this hand isn't really doing anything while this one's working on the neck, but this hand's doing something very important. It's actually staying on the patient. So make sure you're doing that kind of a thing so you can be letting the patient know that you're, comfortable with contact. And that actually makes it more
Stuff
comfortable.
right up there.
You okay there?
I have like knots like all right here.
Yeah.
It's
Now, a petrissage technique for the neck is to, again, with the thumb underneath your hand through the upper trap. So kind of work that through the upper trap from the side.
It's too much.
Yeah, good. I like what you're doing with that. The fingers on top of the thumb, very good. Let your right hand fall down on the patient's.
You carry your stress
I
and
like your
shoulders.
thumb. I don't know if you could try and like. Yeah, that's good.
This is like a friendship.
Good.
Relax.
I
Okay, now let me ask you guys a question. Do any of you, in your experience with us so far, have any particular area that you've been working on that you just feel like you don't quite know how to work on that? Anybody have any? Have we not covered everything? Is there something that you can think of that's like, yeah, when I'm working on this, it just does. I don't know how to do that. Yeah.
The ribs,
Okay.
right here.
Okay, on the ribs, okay, go ahead and lie down on your back here. So, on the rib, now you want to make sure that we'll put a pad up underneath their knees. So if you're working on somebody's rib cage or their obliques on the outside, take one hand, put it underneath their back here, and then the other hand, start here and just kind of work on the rib. What you're kind of doing there is more of moving the rib instead of massaging the muscle around the rib. Okay? Does that feel okay?
Mm-hmm.
Does it feel like it's awkward or uncomfortable?
No.
Okay. So, of course, the patient will be properly draped. You want to make sure they're comfortable. I would prefer that if you're working on somebody's rib like this, if they do have a gown, you can pull the gown up and have them drape the gown with a towel. If you're using lotion and you want to just massage on that rib, but make sure you have the other hand underneath. Okay, that contact underneath there, you're going to get a lot of feedback from the patient by having both hands on them. You're going to feel if they tense up, because that's very important for you to know, so you can change your pressure or change your hand position. And you're also going to be able to feel if you're giving too much pressure to an area by what the other hand is feeling underneath there, okay? So, does that answer that question at all?
Yes, sir.
Was that ticklish?
No, surprisingly.
Okay. Did that answer your question?
Yes, sir.
Any other? Yes, sir. Wow. Okay, we got to tone that down a little bit. Any other questions? Any other areas that you want feedback on? Let's talk about the hip a little bit. Jared, let me have you hop up on the table here on your stomach. Put your head up there and your feet here. So on a lot of times the piriformis and the glute are something that we're working on. I'll come over to this other side. On that, it's really important for the patient to feel safe if you have one hand in a safe place. The glute is a sensitive area, much more so on some than others. So if you have one hand on the small of their back the whole time, then that actually helps them relax. And then when you're going to come into the glute, make sure that you're coming in from the side and working your way more from the lateral side of it to the back instead of from the back to the lateral side, okay? And then another technique that helps them relax with this is to take their leg, bend it up here, and then you can kind of come into it with the heel of this hand, but guess what? Both hands are still in contact with the patient, okay? And you can work into the hip this way. Notice my body position, I'm leaning over the patient. I'm basically massaging them with my torso moving instead of my arm. So I'm shifting my weight to get into that massage into the hip as well, okay? And of course, getting feedback from the patient. Is this okay? Is this comfortable? And just kind of working their hip that way, okay? So that's a good way to work the piriformis. Hand contact is critical, and getting feedback from the patient the whole time, also very critical. Any others? Yes?
The lower back's kind of awkward for me because, like, their back's this way, you know, so I don't feel like I can really get it, and there's not a lot of muscle down there. What do you recommend?
So, can you grab that box there, Sarge?
Good to go, Steve.
Yeah, good to go. So, for people that are, let's have you just hop up your head here and your feet on the pillows. So, for a person that is, Alice is raising a very good question. If you're shorter and it's hard for you to get your body weight over the low back, just go ahead and get the box, even if you're just getting 1 foot on the box or both feet on the box. But then to get into the low back, you can actually get your hands like you're doing CPR kind of thing, like the chest compressions, but these are lumbar compressions. Is that a thing? And you can massage that way. And so you can see that I'm kind of moving my hand across that tissue. So your back massage doesn't have to cover 6 or 8 inches all at the same time. You can pick 1 inch that you're going to be working at a time and then just kind of work your way around the area. And of course get feedback from the patient on where they feel most of their tightness, that type of thing. And getting feedback from them on your pressure is going to be super helpful and important as well. But use a box, use the equipment that we have around to help you get in a better position for the patient. Now, if that doesn't work, again, the sitting position that we used for the neck also can be a good position for the low back. You can have the patient sit down on a stool, lean forward over the table, and then you can sit behind them and work into the low back as well. And that's totally fine. Just so you know, the reason we do modalities and massage first isn't because modalities and massage are the things that are healing the patient. It's because we know that the stretches and exercises and changes in how the patient moves are going to help the patient get better faster. But if we use these modalities first, then it prepares those tissues to respond to the exercises and stretches better. It would be fantastic if they could get that done every day at home before they do their exercises, but they can't. We want them to be very, very familiar with their exercises moving forward, but we want to prepare those tissues for those exercises. So even though we don't bill for any of that stuff, we'll spend the first half hour of the patient's time in the office getting them ready for the stuff that's going to make the biggest difference in their life, not just in the treatment here, but when they're done with us moving forward in their home program on their own. Okay? So this is all preparatory for the most effective part of their treatment. Any other massage technique questions or anything like that? You guys have done very, yes?
Isn't there 3 types of massage?
There is tapotement and percussion.
Yeah.
Those are things that you won't be using, but they would be like, the karate chop massage type of thing. We do this never. And then there's also cupping, if you're doing some kind of respiratory therapy to help them clear lobes of their lungs for breathing. Positioning the patient different for those types of things. But effleurage and petrissage are where we're going to land. Now, Sarah is in her PTA program. We've had a number of PT students that have been with us. We'll teach them how to do cross-fiber friction massage, which is a lot more of a specific tissue response massage than the general effleurage and petrissage that you guys are doing. But yeah, there are other forms of massage. That's a good question. So if you hear me say to Sarah or to Sam or one of the other interns, PT student interns, to go do cross-fiber friction work, that's a very specific tissue manipulation form of massage. Iastim is actually a form of tissue manipulation and can also fall loosely into the massage category. Any other questions? Okay, if there are any waffles left, they need to be eaten. You guys are doing great. I appreciate you coming out this morning. Wanted to really focus on that. We've got a lot of things that we're going to be covering next month at the next one, but we're going to make sure that we get all this stuff taken care of. I want you guys to keep focusing on, you've passed off a million things in your aid packets, but go through those, review those, teach each other, and make sure you're asking questions. If there's anything I could, and I talked to you guys about this last month, ask questions. I'll say to an aide, okay, go do this with this patient. I want him to do this exercise and this exercise or this setup. And I can sometimes tell when I'm looking in the eye of the aide that they don't really quite know what I mean by what I'm going to ask them to do. It means a lot to me if they say, you know what, Steve, I'm not sure how to do that. I can't tell you how happy that makes me to have that question. Because that means to me 2 things. You care about the patient and you want to learn. That's all I want. I want you guys to care about the patients and I want you to want to learn. So ask questions. It doesn't mean I think somebody's stupid if they ask a question. It means I respect you and it means I think you care a lot about what you're doing here. Ask questions. That's huge to me. Okay? All right, let's, yeah.
Real quick, could you touch on electrode care?
Yeah, yeah, good point. Electrode care. When we are taking, oh, Trey, I'm so glad you brought that up. The electrodes, when they are plugged into, when they're on a patient, let's use your arm here. When they're on a patient and there's been heat and there's been electrical stimulation for 10 minutes, that stickiness is like amplified. It really gets sticky. So when you pull the electrode off of the patient, make sure if it's on a limb, for one thing, make sure you always pull from proximal to distal, okay? The opposite direction you would do massage, because it's gonna pull with the grain of the hair and be a lot more comfortable than, I hate to do that, well, I do, kind of. Then if you pull this way and you grab their hairs and pull it with them, big difference, right? The other thing, when you're taking that electrode off, pull the electrode itself. Don't ever pull from the wire. Don't pull the wire off. And it's a lot better if you actually unhook the wire from the electrodes before you take them off. Just unhook them, leave them there, roll up the cable better than those that are there. You guys all know how to do that. I don't have to see that very often, do I? That was subtle. Okay, unhook the electrode from the wire and then peel the electrode off from the electrode itself. Don't ever pull from the wire. Because one of the things that, and I'm glad you brought that up again, Trey, is that when we pull from the wire, we actually separate the cryogel from the electrode, the active electrode itself. And you've seen that on some of these electrodes, these little gaps right in here between, and that ruins the electrode. Worse than that, if we put that back on a patient, if that contact between the cryogel, that's the sticky stuff, and the active electrode fabric, if those are separated and you turn the electricity on, it can arc and form a blister or a burn on the patient. So that airspace, I mean, if you've ever seen a spark on a car battery when you have to put jumper cables on or whatever, it's the exact same thing you're creating with this air gap between the sticky gel and the electrode fabric. So always pull them from the electrode itself, nowhere near the wire. Pull with the grain of the hair if it's on a limb, and unhook the electrodes from the wire before you take them off the patient. Does that help? Okay. Any questions on that? Okay. All right, then. Enjoy your weekend. You guys are awesome. We do need these 3 tables slide back into rooms 1, 2, and 3.